Good morning, Mr. Chair, Commissioners.
Good morning.
Okay. PowerPoint set up here. Go. There, okay. We'll start with some of the data, our usual data, and we're looking at the cases. So the cases in Clay County, as you can see, from September 20th, they were 363, and September 27th, now they're 290, which, you know, might look good, but as Becky has stated, there's quite a lag in the number of reporting cases. There's a almost sometimes a 5-day lag. So it may not, for now, that's where the numbers are at, but of course they're going to change. So we'll see what they look like next week. Active cases in Minnesota, September 20th is 18,000, and then there's 1,000, about 1,200 more active cases as of this week. And then you look at Cass County, they've seen a little bit of an increase as well. So 528 last week and 619 this week for their cases, and also some more cases across the state of North Dakota. We're looking at the active cases by age, and as we've noted over the past few weeks, it's, you know, the younger age groups is what we're seeing for active cases. There's a few more in the 50-year-old range this week, but most of it is in the younger groups. That 0 to 4 had dropped a little bit from last week, but otherwise it's kind of in that age range of the 0 to 4. In the through the 40-year-olds, but we're seeing a little bit of an increase in the 50-year-old age range for this week.
Kathy, have we ever seen, even during the peak spikes of last fall, have we seen these high numbers of active cases in children compared to last fall?
Becky probably follows that closely with her case investigation.
Yeah. No, we have not seen the numbers that we're seeing now in the young children and adolescent ages like we did last year.
Thank you.
So then the cases by age, and we have the total cases on there, the 9,433, that's cumulative. Last week it was 9,267. So again, the age ranges are consistent on the cumulative range. And then the cases per week. So it's, we have just the July through current. So to just kind of show kind of the trend per week and what we're looking at for cases. And then we have this graph that shows from 2020 back in March and through current. So you can see kind of the whole trend from those periods of months where we're really seeing an increase. Okay, then go to Becky.
Good morning. We have unfortunately had a few more deaths in Clay County residents over the past few weeks, so I did include this chart again. We're now at a total of 97 deaths in our county. Next slide. And then this graph depicts the number of COVID hospital admissions per week for Clay County residents. We're still seeing an elevated number of hospitalizations, with numbers as high as they were last winter. We typically refer to hospitalizations as a lagging indicator of a resurgence of cases. So usually we'll see an increase in hospitalizations within 2 to 3 weeks of seeing a spike in cases. So this is of course the concern that we're facing now as we look ahead to the coming weeks with our case numbers being elevated. And this slide breaks down recent hospitalizations of Clay County residents by age. So as you can see in the pie chart, the majority, 65% of those that have been admitted to the hospital in Clay County are under the age of 65. The bar graph on the right shows the breakdown of the individual age groups of Clay County hospitalized cases. And so the average age has been 54 since August 1st. And then this slide shows statewide hospitalization data for the state of North Dakota as of yesterday. So there's currently 133 hospitalized due to COVID, with 21 in the ICU. The number of hospitalized cases has increased from 120 last week, but the number in the ICU remains the same. The chart in the middle shows current hospitalizations broke down by age, and then the chart on the right shows the age groups of the total admissions throughout the pandemic. So you can see that the majority has been in those over the age of 65, but we have recently begun to see an increase in pediatric and young adult admissions.
Just want to double check that I'm reading this right. So according to your numbers, there's been 2 hospitalizations for Clay County residents 19 and under since August 1st, correct?
Correct, yes.
And then just to maybe piggyback off Commissioner Campbell's question about the resurgence in young pediatric cases. Currently, we have 102 active cases in Clay County from folks 19 and under, but historically, we've had 2,102 cases from 19 and under. If I read
From the beginning of the pandemic.
right, just at, am I, okay,
Right.
okay,
Yep.
thank you.
Right. I guess my question was more, because we knew that the 15-year-olds a while back were still a higher amount. My question was aimed more at the younger ones and when I see 0 to 4 and the 5-year-olds and those that's the number that I'm concerned about, where I see where that's going.
Right.
At those numbers, I don't think there was very few of those in the number that Commissioner Mojo mentioned about the 2,000 going all the way back.
303.
Right. So the majority of those that we're seeing now are, in that cumulative pie or cumulative bar graph are recent reported cases.
Yes, Commissioner Beer.
Would that be because of the Delta variant? Is it more of an impact on
Yes.
kids?
Yeah, that's what we're seeing. Yep.
Okay.
Right. And then this is the updated graphic that the Sanford Hospital System puts out on a weekly basis. So this is updated as of September 21st. Again, the red people represent those that are not vaccinated, and the white represent those that are vaccinated. So the overwhelming majority of hospital cases continue to be among the unvaccinated. And then of note, of the 34 patients that are on ventilators, only 1 is vaccinated.
Okay, I will report on the vaccines that we have been providing. So for Clay County, the total number of doses provided by Clay County Public Health, 15,563. And last week, we provided just 28 doses of vaccine in our clinic at the Family Service Center. And then looking at the next slide on the statewide data, people with at least 1 vaccine across Minnesota as of September 23rd, we're at 72.1%, and people with completed vaccine series statewide, 68.4%. So continue to climb with vaccine opportunities. And then just the breakdown as we've been looking at, it seems to be evening out a little bit. And we've seen a very high percentage of the 65 plus, but things are starting to catch up as we are providing vaccine to the 12 and over. And then I'll just talk a little bit about what we have planned for this week. Last week, what we do is every other week we do an evening clinic, and then we try to do a clinic over to the lunch hour. So last week was our evening clinic, and then this week we are doing a clinic from 10 to 2 at the Family Service Center. We do have Johnson & Johnson vaccine available this week, so we've
are providing a walk-in opportunity for that, and then also asking people to register. We're doing some second doses of Pfizer and Moderna. We have all three of those available this week. And then on later today, local public health and Minnesota Department of Health will have a discussion about planning for boosters. So we do not have any booster scheduled for this week, but later today we'll find out what the plan is and vaccine availability for that. And we'll be working with our team to make some plans for that. And breakthrough?
Speaking of Department of Health, have you heard any word on Clay County Public Health with flu shots being able to, that you're waiting before to hear from?
Flu shots, we have our protocols. We've sent them off to our medical director, and so we are also planning for flu shots right now. So working with not just our own, employees, but with other employees. So they're reaching out and we're making plans. We have the 2 scheduled so far, and we'll continue to work on that.
Thank you.
And then just looking at the breakthrough cases on the next slide, breakthrough cases in Minnesota this week at 0.89%, and that's up from last week, which was 0.749%. And then breakthrough hospitalizations, a little bit up, but still low at 0.047%. Breakthrough deaths at 0.004%.
So just to clarify, less than 1 out of 100 who have had the vaccine is
Right, exactly.
coming down with COVID again.
And that's why we,
Or not again, but
right.
testing positive.
And I think also important to note the Sanford Hospital slide, the reason we're sharing that, because it shows the hospitalizations and the low numbers of vaccinated people. Anything you want to add to that, Becky?
I don't think so, no.
I have a question quickly.
Commissioner Mojo.
Do we have an estimate on the percent vaccinated of staff?
No, we do not.
Okay. I think as we move forward as a board, and I know there's some regulations that have been passed nationwide that are waiting on some OSHA approval, but I think it's important for us to get a good handle on what our estimate of staff vaccination is as we talk about what policies should look like. I think it's important to know that, considerably important because of what the breakthrough percentage is. Certainly, it doesn't take much to look at a graph and understand how to stay off of that event. I mean, if you're talking vaccine versus not, so I think that's important. The other thing, I recently have been part of 2 of my different committee assignments and talking about the new requirements that will be coming down. And for companies that have required testing already, there are several different instances of significant testing shortages. And so knowing what may or may not happen, what are we doing to ensure there's testing availability? Lakeland Mental Health, for instance, is trying to figure out if they're technically qualified under a healthcare setting or not, and has realized that there may be some significant shortfalls in that availability to get staff tested on a weekly basis. What are we hearing?
They still have the testing through Walgreens, and of course, we have the Vault testing site. The downfall of the Vault testing site is it's not a rapid test, so you wait a little bit to get the results, and they are not currently open on the weekends as well. So I think the challenges for people is how do they get a test after hours on the weekends or during the weekend, Saturday and Sunday, because you're really limited if you can't get a test through Walgreens. We do know, I just heard yesterday that the location over in Fargo, and they were accepting all Minnesota and North Dakota residents for testing. They've become overwhelmed because there's so many Minnesota residents going over there. So we need to work on a plan. I need to work with MDH to see if there's any potential to get, we're really needing rapid tests in our county because we just don't have those. And not to overwhelm they want us to kind of work on something. where we can, that there's not so many that are coming over to the Fargo site. So I passed that on to my team yesterday, so we're gonna be in communication with MDH about what other opportunities there may be to get testing in Clay County. We're also going to see if maybe Vault can expand their hours. So we're gonna have to work on some other opportunities for testing because there's a lot of demand now.
Well, and I know that the ARPA committee has talked briefly, even before the maybe President Biden's regulation, about testing availability. And, you know, as we, again, back to the policy piece, as we figure out what a policy looks like for Clay County in terms of day of the week for testing, that certainly will be shaped dependent on where you can get that. And I think maybe, is it Wednesday this week, we have a committee meeting? You know, I think that really needs to be at the forefront of our discussion. If we can't get rapid tests, maybe we need to look at purchasing.
We have the availability in public health because we have a CLIA waiver, so it's a lab waiver. So we have the ability to order some rapid tests, which I have done in preparation for our employees, if we need to get testing done and when the board decides we'll do that. So I have some available at this time. We're looking at some other test kits as well that we could potentially order, but it's limited. The numbers are limited, so I wouldn't, we don't have the authority to order for the whole community, but I can order for our internal process.
Well, and I understand the conversation needs to get moving, but you know, Darren, looking at you, I think 650 employees roughly, if we're looking at what percentage of those are vaccinated, I mean, even 50%, I'm hopeful it's more close to that 70%. We need to start figuring out how many tests we would typically need on a weekly basis and go from there.
I would like to just go back in the testing in Clay County. How are those numbers going? We still have that facility open, right? Jamie?
We do, and I think Kathy gave you a copy of that. And so that's what Kathy's talking about. The saliva testing it's great, it works well, but it's a 24-hour turnaround. And so
that's
that's
what
why
they get
people are
going there.
crossing the border because of the rapid test. And the saliva test is the PCR test, and it takes 24 hours for a turnaround time for the lab. But that, as of September 19th, the positivity rate was at 6.24%. And you can see the numbers there as far as the number of people that have come in, the breakdown of Minnesota. So it's continuing to be used, but what changed is it was open 7 days a week initially, and now it's Monday through Thursday. And so when people want to test, you know, over the weekend to see what to do about Monday, school and work, they're going across the border to the rapid testing site.
So what's the criteria that's recommended? What are the reasons why someone should go to that facility to get tested?
On the Minnesota side or the
Yeah,
North?
is it because of potential close contact with someone?
Potential, basically. If you're vaccinated, you know, they say you can continue to do what you are doing, and also just really watch for symptoms. But it also, because we do have some breakthrough, as limited it is, people are being encouraged to test 3 to 5 days after a known exposure. And so that's really what it comes down to, especially for our kids who are not able to be vaccinated. A lot of parents are taking kids to be tested because of a known exposure.
And a known exposure, where they know that that's happened, it's been 45 days, whether or not they, when they go in and they don't have the rapid test and they have to wait the 24 hours, the old standard guidance that was always given is that they remain quarantined until they get that information, isn't it?
Correct.
So that hasn't changed.
Well, there's some changes in terms of the school system, correct, Becky?
Right. Yeah, so school districts are kind of doing what works for them, so we're not seeing it even across the board, you know, in terms of quarantining. The recommendations from the Minnesota Department of Health is, though, that if you are in close contact with someone that's tested positive with COVID, that you quarantine.
Until you can get a negative test?
Well, there's a few different options for quarantine. So you can do a 7-day quarantine if you do test negative on a test 3 to 5 days after exposure. You can do a 10-day quarantine as long as you're not having symptoms, or the 14-day quarantine is still considered the safest.
And then just briefly, how are we doing on contact tracing? I haven't heard much about that lately. Are we still, is that even more significant now since the Delta variant came back on us here?
Yeah, we've brought on 7 new staff, which I'm working to get trained in, but we are struggling to keep up with the amount of cases that we're seeing.
And then lastly, back on the tests, the over-the-counter tests that people can get, is that something that's reliable, or?
Go ahead, Becky.
Becky, do you want to take that one?
I can. Not as reliable as what you would get tested at a pharmacy or clinic or testing site. And also, if you get a positive result with an over-the-counter test kit, it is not reported to the state health department, so that makes it a challenge for us, because then those individuals are not counted in our case counts, and we can't do the case investigation and the contact tracing.
Any other questions?
So,
No.
no.
Okay. Here.
Some boosters are out for the Pfizer, and for those, I think we're going to go back to the discussion we had with immunizations over there. If someone gets a booster in North Dakota, they should go to our website and link into the state and report it. Am I recalling that correctly? So that we can get our count on who's had a booster?
If the booster is through the health system, so if it's through Sanford or Essentia, it'll eventually get to our immunization registry.
If it's through Cass County,
Correct.
it would also.
Right, it's the pharmacies that we were not able to get that information.
Okay, thank you.
Correct. Correct. Right, Moderna and Johnson are still going through the process. They'll eventually have their boosters, but not yet. And also the 5 to 11-year-olds, they're also, still in the studies about getting that vaccine for that age group. So, there's an anticipation that that would come in a month or two, but, so we should be seeing that as well. Well, there's plenty of vaccine available, so it will be, we need the manpower.
Hey, Mike, Don, I'm sorry.
Yeah, so we'll need people, obviously, we'll be doing flu shots, as well as if MDH is gonna request that we do boosters, so we'll be doing flu shots and boosters, and then maybe doing the younger age children as well, and those that still are getting that vaccine. So there will be, I think we could be really ramping up with our vaccines, so that may be a thing we can talk about at our meeting on Wednesday.
Commissioner Cayley and then Commissioner Mojo.
Kathy, I was wondering if you've been in contact with our local hospitals to see how they're feeling about this ramp up in cases and increase in hospitalizations. How are they doing staffing wise?
Yeah, thanks, Commissioner Cayley and Mr. Chair. We have been in contact with the hospitals. Their concern is, of course, that they're at capacity and looking at the need to, maybe not accept some patients and having them go to other places. So their real concern is the number of cases they're seeing, in addition to all of the other cases that they normally have. They're, seeing the increase in COVID cases, but they're also concerned about staffing. There's certainly a concern that they can keep up. Staff are overwhelmed. They're hitting breaking points and tough to recruit staff. So they have a real concern about staffing. So it's twofold for the hospital systems with just the ramp up of cases and then staffing. So that could be a real issue. And their concern is just that this has not gone away. COVID has not gone away. And in fact, speaking of hospital systems, they really want to push masking. They're feeling like we have some prevention measures that we should be taking. Number one, obviously, is get the people vaccinated that have not had the vaccines yet. So that's really the primary, because that's really kind of the lead in what how this is being spread. So really to just continue to push people to get vaccinated, and with all the research, I mean, the vaccines are safe, so, you know, it's a challenge to get people to understand that this is a real high priority. And the other thing is the prevention measures about social distancing and masking. So they ask that we require masks in public places. That's a challenge to implement because we don't have an emergency declaration. So we don't have authority to push the masking in all of the businesses. But masking, if you're in in-person meetings, in public health and in social services, I can speak for those two departments. We're masking when we're doing visits, home visits. Most of the time we're trying to do remote. So all of our work is still pretty remote. And so that's kind of what the push is, to try to do as much remote as you can. And then when you're in groups, really should be masking. If you have meetings, especially when you can't social distance, particularly when you can't social distance, so, and then in public spaces. So that's their request, is that we would do a requirement of masks. We have people coming into our Family Service Center building that aren't masking, so I think that would be a important.
Did you say that or not?
They're not, right, because it's recommended, so the majority of people are not masking. So that might be a recommendation to require masks for people that come into our buildings. Minnesota SEP required masks starting this week. And of course, our dental, and they're our tenant in our Family Service Center building. And then the dental's requiring masks, obviously. They've been requiring masks since the beginning. So it might be a prudent measure based on the hospitalizations and MDH recommendation that we require masks for public spaces and meetings and for visitors that come into our buildings. At this point, we expect what our epidemiologists are saying at MDH is we expect to see, you know, kind of the peak fairly soon, maybe a few weeks. It's hard to predict an exact time we might peak, but for this interim period of time, it would be just a good prevention measure to help with even breakthrough cases. We're seeing a number of those within our county employees as well. So that's a recommendation from the hospital systems.
Commissioner Mojo.
Thank you. In talking with some members at Sanford and hearing their concerns in terms of the fact that they're bringing back those non-essential surgeries now, and so they're kind of dealing with that and a surge at the same time. What are you hearing? You know, I recall it takes about 2 days to set up that field hospital at the Fargo Dome. What are you hearing in terms of if that's a possibility? I certainly know that it's challenging because Bison football is also important in Fargo, but what are you hearing?
You know, I think they're looking at those options and working through that logistically. Right now, they have an area that they can expand to, and I don't remember what the bed count would be, but they have a potential for an expansion in a facility. It wasn't the Fargo Dome.
1,500, I think, is what the Fargo Dome had before, but
Yeah,
it's,
but I know that would be an option, and they would certainly work with the National Guard and all of that if they needed. They haven't mentioned that publicly, and they haven't mentioned it to us yet, that's what they're looking at, but I wouldn't be surprised behind the scenes if they're actually thinking about Plan B, C, and D.
okay, thank you.
Anything else? Commissioner Cayley.
Given the stress to our local hospital systems and what we've heard, that this is now a very strong recommendation from MDH and others, that we institute a masking policy in public places, I would like to move that we require masks in all public spaces in county-owned buildings, and that we would reevaluate that after a 14-day period of a decline in our case rate, pending other recommendations from our local public health. That 14-day seems like a good number, since that's the standard quarantine period that we were seeing before. So.
Second.
I have a motion by Commissioner Cayley and second by Commissioner Ebbinger. I have a question, and it gets to, this was brought up before, and the motion was made and seconded by the same two commissioners. And I know in the past, we've had taken a position that it would require somebody different to make that motion.
I think, Mr. Chair, so I just did a little research, so the position I would have is that the motion is in order.
Okay.
So, I mean, I think when I look at Robert's Rules of Order, the chair would have to declare that that motion is not in order, but specifically that, I'm just going right off there, that no main motion is order that presents substantially the same question as a motion that was finally disposed of earlier in the same session being rejected. A main motion that was thus disposed of can, however, be renewed. That is, the same question can be introduced again as if new at any later session. So I think what Mr. Chair might be thinking of in other times past is where it was the same session brought up again. The whole idea is to really dispose of something.
Yeah.
But if it's in a new session,
And where I've seen, Mr. Melton, where I've seen this come up more often, I think, too, is in regards to planning and zoning applications and processes. And the idea in mind there that if something is rejected, somebody just can't just keep bringing up the same thing all the time. And I just wanted to make sure, I certainly won't deem this out of order. I won't do that as board chair. I just wanted to.
and Mr. Chair, you are correct. And that was the point I was making. There are things in planning and zoning, or just like in a legislative session, if a bill has been introduced, rejected, it's 1 year usually, but this is not the same matter in my position, looking at that. This is a new session, so.
I would like to just ask for some clarification on the motion itself. Within our facilities, and this goes to, we've done an awful lot of things since COVID started, and we went to an awful lot of investments to make it safer for both our employees and our citizens who come in. And it seems to me that the way the motion reads would be that masks would have to be worn in all public places, which the way that I read the motion, it would mean even within an employee's confined personal private office space. And I certainly
No.
don't think we need to do that. So I just, there has to be some clarification there as far as I'm concerned, that it's basically in the common areas, right? Kathy, is that what you'd be referring to, the common areas of public spaces?
Correct.
Whether if you're going to walk the halls or that type of thing, right?
Right,
Is that the intent
Always
of your?
lobbies, yep.
Is that the intent of your motion?
Yes, that's the intent.
And then I just one step further. So all of the motion would also mean that anybody who comes into our facilities would also, how about all of our staff who are required to go out on house visits? I know when there was the emergency order declared, there was basically no home visits, except for situations of concern, whether it's child protection issues or those types of things. How do you feel, if it's appropriate for me to ask this before we make a vote on this, but how do you feel, Kathy, about allowing our county employees to be going into homes? And I think of anybody in social services that might have to go in, including those who are going into daycare facilities, which right now we're seeing these big spikes in. What are your feelings on that?
And we've worked with, and Jamie can jump in as well, we do a lot of home visits in public health, and social services does a lot of home visits as well. Our Wic program currently is still under a waiver, so that program is through December. They aren't seeing kids and families in the office at all. And that waiver was through the state. So they are only doing telephone calls, and people are still getting their WIC vouchers. We're not able to weigh and measure and take hemoglobins and do those kinds of things. So, but they're doing what they can, and that's under that state and federal waiver. Our home visit programs, and Jamie can speak to this, as well as social services, we've been in contact with Rhonda in regards to home visits, and if there's a need to do home visits, we did recommend masks, that they mask as well as the person that they're visiting. So I know that social services was going to follow that. It wasn't a requirement. They just thought it was in the best interest of everyone to mask. And Jamie maybe can talk about our home visiting.
Jamie?
I think it's important to note that we are seeing the most vulnerable citizens in the community. And so, yes, we have been following the practice of masking, social distancing as much as possible, but more importantly, limiting visits to those that are essential. So whether it's public health staff or social services, we are following that policy, and we've worked with social services on the policy. There are times when it's not avoidable, and then we are distancing as much as possible and masking.
Since the emergency order was lifted, the Department of Health and Human Services, I think they kind of basically set some guidelines or regulations or whatever you want to call it regarding home visits, and that no longer exists. So do we as a county have the ability to do things on our own?
So it is still in place when it comes to those that we serve that are on medical assistance. So there are still some things, and whether it's Minnesota Department of Health or DHS, that help us to continue to do remote visits and still receive reimbursement. So we're meeting our criteria at the federal level is what allows us to follow that. And so we are doing that, and that certainly makes it much easier for us to focus on essential visits, so a vulnerable adult, a child protection, those are when we are going into the homes because it's essential. Otherwise, we are doing our assessments, our teaching remotely.
Thank you. Commissioner Ebinger.
I genuinely do not like this motion. I don't like masks, but the numbers don't lie. And we have a public health staff that has gotten us through a very difficult 18 months at great strain to them and to their ability to keep up, but they've been relentless. And I know they're loath to come in and make a strong recommendation to elected officials, but the information they provided us speaks for itself. And maybe this, we can hope, this is the fourth quarter, and we just got to buckle down and deal with this. We can hope that as immunizations get higher and precautions are taken, maybe we'll get through this winter and we'll get ahead of this thing, but right now we're not. And I'm hearing loud and clear from them that this is a recommendation on what we can do. This is not a public mask mandate. This is a mandate for the facilities of Clay County. And it's a reasonable, structured one. And, just got to go with the information from the people that got us through the worst of this up to this point and try and, I hate to beat the football analogy into the ground, but it works for me. This is fourth quarter and you don't let up or you're going to have a problem. So, I hope my colleagues will appreciate the fact that this is good for our employees, even though it's an inconvenience. Certainly good for the public that comes in here, and it's good policy. Thanks.
Commissioner Mojo.
Thank you. Oh, Commissioner Emberger is all about the football analogies since his Razorbacks have, redeemed themselves, but I appreciate that. I have an issue with the motion just for a couple of reasons. I think that, one, I'm particularly bothered by adding a policy change when it was not advertising the agenda. I think that is a way to not allow our staff and citizens time to understand the conversations at hand. And two, I think that when this was brought before us I was very clear that I wanted us to make sure our PIC had an opportunity to look at the policy and make sure that we were being consistent in at what percentage of staff positivity rate or quarantine rate do we go into a masking recommendation or requirement? And I don't know if we've had those. As I had conversations with our HR director yesterday, of the 615, I misquoted myself earlier, staff that we currently have 8 out with COVID, close quarantine, or positivity. And so I'm a little concerned at making a policy change when we have 1% of staff or 1% of Clay County that are currently with the 291, or not 291, the 290 out. And I think that I'm not ignoring what you're saying. I'm so thankful for the work that your staff has done through all of this, but I think as government, we have to be very careful about being consistent. And if we have 10% of Clay County out with influenza and it's very contagious, are we going to require a masking requirement in buildings? And so it just opens us up if we're not being consistent. So my other clarification is, does this require, what about our jail, our juvenile center? Are they all masking at all times? There's just so many unknowns about this. I'm concerned that we haven't had adequate time. Steve, have you come up with a policy?
Madam Chair, their PIC has not come up with a policy, no.
So this has been a board that has been very careful about making sure that we are addressing the needs. I still would maintain that we come up with a policy, knowing what you're saying. We need to come up with a policy. And then we can address it in an advertised fashion that makes more sense. We also spent lots of money that we had allocated to us to ensure that there was social distancing that would keep staff and the public safe. And so I think going back to what I said about vaccination rates with our staff, if we're seeing 256 that have had COVID throughout this entire time of tracking it since April of 2020, and are we looking at 70% of staff that are vaccinated? We need to encourage our staff to get vaccinated so that we don't have to have these conversations.
Am
I done?
Yeah.
God, Brad asked me all the time, are you done?
I'm just.
I don't know if I'm done.
I'm trying to be polite here.
I think so.
Thank you,
Chair,
Mr.
thank you.
Catley.
I hear what you're saying, Jenny. But this isn't just about our staff, it's about the public. The public is in and out of these buildings constantly. They're attending meetings, they're receiving services. Those are the people that we need to be protecting. Those are the people that are in the spaces where social distancing cannot be maintained, and that is what this motion is speaking to.
I completely understand, and that's why we spent the hundreds of thousands of dollars to make sure that all services could be accessed online in a non-contact fashion.
Mr. Eppinger.
Just in looking at consistency, City of Moorhead, City of Fargo, Cass County, all re-implemented masks within their facilities. We had a long period of time where we had masking policies for the county, and yeah, I agree. Phenomenal efforts were made to make our workplaces safer. But this is not the first round that our employees have had with dealing with the mask situation, and it should be reasonably easy to implement. This is a week by week. If you look at these numbers, I mean, we can put it off for another 2 or 3 weeks, but we're just aggravating the situation. We can make it a little better within our workspace, within what we control, and I think that some expediency is appropriate. Other governments here in our Cass-Clay County area have done it, and I certainly don't see where we can't implement it with some expediency.
Thank you. I can't ignore when our public health department makes a strong recommendation. And I can't ignore, I often sometimes worry that if you don't go in accordance with a recommendation by something as serious as this, some of the ramifications of not doing it down the road. And I don't want to take chances on that. I agree with almost everything that Commissioner Mojo said. I'm very nervous about doing this, like she said, without being as an agenda item regarding a policy. However, I believe we're in emergency time. We've been watching this on a week. That's why you're here every week, is we want you here every week, and I'm talking about our public health department, so that we get updates as this thing either gets better or worsens. There may be a slight indication that this week over last week there was a slight improvement. I'm extremely nervous about the young children that are going on and how it's spreading to them. The motion said that this would be reviewed in 2 weeks, and I think that would allow us the time to come up with if it's going to continue. And we haven't really talked about what is going to be our determinating factor to remove it. We said we'll review it in 2 weeks. What are we reviewing, and when is it going to be satisfactory to us to remove it? I haven't heard that yet. So in 2 weeks' time, unless we come up with some things, then I probably will not support continuing it. So this is a 2-week deal as far as I'm concerned. I'm going to vote in favor of the motion this morning. And I'm going to do it with that in mind, that this is 2 weeks and it gives us time. If we have to have a special PIC meeting, we'll have a special PIC meeting, and we'll get the data going and move forward from there. But I am not going to vote against, especially when I hear the word strong recommendation from public health to do this. I have some concerns that this doesn't do enough in terms of some of our employees who have to leave facilities to go to other places, both from the standpoint of their safety and the safety of those who they're going to see. And quite frankly, I'm referring to daycares. And nothing in this motion deals with that whatsoever. So, and that's where all of these kids are, that there's potential more risk. So I've said, anybody else have any comments on the motion? Seeing none, would you like a roll call vote on this? All in favor signify by saying aye.
Aye.
Aye. Opposed, the same?
Aye.
Motion carried. And that, one last thing on that, I think we better have that effective tomorrow. We can't, because we probably have a lot of people here today that maybe not have their materials. So is that okay?
Yeah. Mr. Chair, Kathy, could you also work with GIS in developing exactly the verbiage you'd want on those signs?
Sure.
So, our correctional facility and our juvenile detention facility masking.
I've not had recent conversations. I see Justin's here. In our previous conversations, I know that our juvenile counseling staff and correction staff were masking up when they were with the residents and inmates, and so I don't know if that practice has changed at all on your end or not.
Justin, I think if you're going to talk, we need to grab a mic.
So the staff at the jail are wearing masks while they're in the facility from the time they enter the facility. That was something we changed just a couple of weeks ago due to a staff coming down with COVID. But I guess I do have a question as far as having an inmate population required to wear masks becomes a very, very difficult thing to enforce. And when we're talking about individuals within a county building, where do we stand as far as, and how do we start to begin to enforce that?
And Mr. Chair and Commissioners, our detox is in the same boat. We have people coming and going constantly. Our masking for detox is the staff. We don't mask the clients. The staff are masked.
So we just voted on a policy, again, that we haven't ironed out details. And I agree with you. If you have a shortage of staff anyways, and you're dealing with populations that are not necessarily excited about being in there, have fun.
Well, again, I think, Steve and Darren, let's get a PIC meeting set up ASAP, please. And we'll get some clarification on, and we can maybe come back even before the 14 days that doesn't mean that we can't revise what we've done and give further instruction as to what should be done. Kathy, you'll be part of that PIC meeting.
Okay. All righty.
All right, anything else on that? All right, well,
That's it.
there you go. That was a
Thank you.
good 10-minute update on COVID. Thank you all.